Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Chairman, Presidential Task Force on COVID-19 asks Nigerians to accept vaccination against the coronavirus. Says it may soon become a precondition for travel. Schools finally resume in Kaduna State after extensive appraisal of the second wave of the pandemic. And the first batch of Oxford AstraZeneca vaccines arrived South Africa from India. Begin with the Nigeria Center for Disease Control and CDC. The Nigeria recorded 8 new deaths Sunday night, raising the death toll to 1,586. It also recorded one of the lowest daily infections of 685, which were reported in 16 states, excluding the Federal Capital Territory. Lagos recorded the highest number with 355, Kaduna 58. Nasarawa recorded 46, Kano 40 cases. 33 were recorded in Akwa Ibom. Katsina recorded 26, Ogun State 25, Osun 21, Rivers 16, Edo State recorded 15 cases, Oyo 13, Ondo 12, Borno 11, 9 were recorded in Ekiti State, while 3 in Kebbi and Plateau State recorded 2 cases. This figure puts the total numbers till date at 131,242 cases, while 104,989 cases have been discharged. Now, last night, Lagos recorded 901 community recoveries and 123 community recoveries were recorded in Plateau State, managed in line with the guidelines. So far, the total number of cases that are active are 24,667, and states like Lagos, the FCT, Nasarawa, Oyo, and Rivers are the top 5 states with over 700 cases on admission. Kogi is the only state without a case on admission or isolation, with a total of 5 confirmed cases, 3 discharged, and 2 deaths recorded by the NCDC since the pandemic began. As Nigeria continues to battle the second wave of the virus, the presidency has warned against non-adherence to the safety protocols to stem the spread of COVID-19. But since the pandemic broke out in February 2020, the country has carried out over 1.3 million tests. And this is also information from the Nigeria Center for Disease Control. Now, the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, says the world is embracing vaccination and Nigeria cannot be left behind because soon no one will be allowed to travel to any part of the world without vaccination. He mentioned this during an awareness meeting by the National Primary Healthcare Development Agency on COVID-19 for Christian leaders and scholars. While urging Nigerians to wave off negative conspiracy theories, he assures that the vaccines expected will be properly screened by NAFDAC before administration, and the government will do all it can to ensure that at least 70% of the population get it.
They don't need vaccines to kill us. We eat too much of what they produce. They can kill us through those things. They don't need it. There's hardly anything that is on your table that is not imported. So why do they have to waste their time and allow their people to die? Before they send vaccines out here, we will do everything to ensure that vaccines are made available to every qualified Nigerian. And our intention is that in 2021, we will vaccinate at least 40% of the population. And in 2022, vaccinate another 30% of the population. So that a combined effect of 70% of the vaccination would take us to the level of developing herd immunity. I can tell you with every degree of confidence that the West and the other developed countries are just waiting to vaccinate their people. Once they are through with their own vaccination and they reach the level that can qualify them for herd immunity, they will not allow anybody coming to their country unless you carry a vaccination card. So whatever conspiracy theories that are out there, be prepared to wave them away, because the vaccines that are coming would have to be qualified by our NAFDAC as safe and effective before it is administered on our people.
The Osun State government has reported 5 cases of the COVID-19 strain, the B117, first discovered in the United Kingdom. The State Commissioner for Information and Civic Orientation made the announcement yesterday, according to her, considering the continued disregard and defiance for safety protocols in the state. The government is extremely concerned about the days ahead. This development comes less than a week after the Presidential Task Force on COVID-19 announced that the virus strain first reported in the UK has also been found in Nigeria. The National Association of Resident Doctors, NARD, has raised an alarm over the increasing rate of exposure, infection, fatality to the deadly coronavirus disease among health workers, especially resident doctors in Nigeria. The national president of the association disclosed this in Owerri, the Imo State capital, during the association's National Executive Council meeting and scientific conference.
NEC demand that the current hazard allowance be upwardly reviewed within the next 2 months in order not to encourage our members to continue to work at this critical moment of increasing rates of infection, mortality due to the ravaging COVID-19 pandemic, and to maintain industrial harmony in the health sector. The NEC resolved that the group life insurance scheme for all health workers be speedily implemented, and all health workers who have been infected or died as a result of COVID-19 or any other disease in the country be compensated. The NEC demands immediate universal domestication and implementation of the Medical Training Act of 2017 by all training institutions, including state-owned training institutions, to ensure proper funding as stipulated by the Act. They urge the National Officers' Council of NARD to work closely with the relevant agencies of government to expedite the payment of the 2021 Medical Resident Training Fund in order to prevent the mistakes made in 2020.
Today, all public and private secondary and primary schools in Kaduna State resumed for their academic session in compliance with the state and federal government's directive on COVID-19 protocols. The schools resumed nearly 3 weeks after their counterparts across the country reopened for academic activities. According to the state's Ministry of Education, the decision to reopen the schools was taken after extensive appraisal of the second wave of the pandemic in the state. Let's find out some more about the decision there in Kaduna. And the Permanent Secretary, State Ministry of Education, Mrs. Phoebe Yayi, joins us right now on the program via Zoom. Thank you for joining us. First, tell us what changed that made the government take a U-turn to reopen public and primary schools.
Well, in Kaduna State, we didn't resume on the 18th as announced by the federal government, because we have our own peculiarities and we're also monitoring the situation. We're also in consultation with the Ministry of Health and other education stakeholders. So to be sure that our students resume back to school and to be safe, we wanted to be sure that yes, all our protocols and all the measures were put in place. And within this same period, we may recall that the civil servants in Kaduna State were undergoing the COVID test, which was the Ministry of Education was also part and parcel of it. So we were also in consultation with others and then holding on to see how much we will be able to put in place to be sure that we have the safe return of our schools and be sure that the schools were ready. And it was only after the consultation and the assessment of the schools in the state and then government putting all the necessary measures in place that we felt it was safe and it was convenient, and with all the stakeholders also being on the same page, that we now decided that the schools should reopen effective 1st February, which is today.
When you said COVID-19 tests, does that also include some of the teachers of the public schools?
All teachers, all civil servants, and of course, teachers are part of the civil servant. All civil servants in Kaduna State underwent the COVID test as directed by His Excellency, the Governor of Kaduna State.
Tell us about the resumption for tertiary institutions. I know initially they were meant to resume, but only final year students writing exams. So are all schools, including all tertiary institutions and all levels, are they all open in Kaduna State?
The tertiary institutions in Kaduna State opened since on last week, the 25th of January. Initially, we had some of them who had requested for assessment because they were ready to, they had planned for exams for their students. While that one was still going on, we were also undertaking the assessment and also consulting with others. So initially, like for Kaduna State Kaduna Polytechnic, the Federal Polytechnic in Kaduna, they had requested that we go and assess the school and to find out if they were ready for school reopening, which we did. But that was just for them to write exams. But in the course of doing that, we were still consulting, and then eventually other institutions and other higher institutions of learning in Kaduna State were also requesting, which we sent out teams to go out and assess the schools and to be sure that, yes, they have met all the protocols and they were ready for school reopening. So that was why tertiary institutions were given that express permission to open on the 25th of January. And this was also in line with our opening of schools in phases, to be sure that at least we are monitoring and then we are assuring that all protocols are sustained and all protocols are in the right position and students are also abiding and the teachers and the school communities were also abiding.
The COVID-19 fatigue is really affecting a lot of countries and, Nigeria is no different. So in terms of the education that's going into the safety measures, what kind of monitoring is the government putting in place to mitigate the risks among students, pupils, and the teachers being affected by COVID-19?
So far, schools in Kaduna State have been decontaminated. And then all bushy areas have also been cleared. Schools have provided isolation hostels, that is for boarding schools. And then for day schools in the secondary schools, they have also provided holding areas to be sure that, yes, when there's a suspected case, they will be able to isolate such a person. And even with that, teachers during the first wave were given a train the trainers workshop, which means that they'll be able to identify a suspected COVID case and they'll be able to handle. And with all the items being provided as part of the protocols, they were also trained on how to handle them. And the Ministry of Health have also put in place measures to train health personnel in the schools where they have clinics to be sure that, yes, they are able to refresh their capacity to be able to undertake assessment and be sure that those who are suspected to be positive of the COVID are isolated and immediately reported to the Ministry of Health, and also measures will be taken to begin to treat them appropriately.
All right. We'd like to appreciate your time. We wish you, your ministry and the state the best. Permanent Secretary, Kaduna State Ministry of Education, Mrs. Phoebe Yayi, thank you for joining us on the program.
Thank you for having me.
All right, we have more stories coming up and we'll be taking you to Kano State about the special COVID-19 marshals to ensure compliance to the protocols. Do join us again. The Kano State government has set up special COVID-19 marshals to ensure strict compliance to NCDC protocols. While inaugurating the marshals, Governor Abdullahi Ganduje stressed that unless a completely new approach is adopted, Kano may have to go back to the drawing board. Our correspondent Idris Jibrin reports.
To ensure enforcement of the COVID-19 protocols across the states.
COVID-19 is back again. Therefore, all our efforts must be back again in order to ensure that we curtail this pandemic this time around Many people are dying, and we cannot wait and see the continuous spread of this pandemic among our population. We must take adequate measures.
Kano State is fast recording more positive cases and death, which calls for proactive measures.
The ministry has also been undertaking regular disinfection of public premises, such as motor parks, markets, churches, mosques, remand homes, densely populated communities, among other places. So far, the ministry has been able to disinfect more than 500 premises in the state.
In order to achieve the desired results, these marshals will be supported by the traditional institutions, while mobile courts will be provided to prosecute anyone who fails to comply with the safety protocol.
We are calling on these marshals to make public enlightenment a top priority and ensure punishment of anyone who fails to observe the protocols. We therefore assured the state government of our total support to any policy and program aimed at preventing the spread of this virus among our people.
In the next coming days, these marshals will be on every street, marketplaces, places of worship, and densely populated areas with the enforcement of the COVID-19 protocols across the states. Idris Jibrin, Channels Television News.
Come November 6, a number of states will be electing a new governor to take over from the current administration. And from all indications, the elections may be conducted under the coronavirus pandemic. Well, the challenge now is how the Independent National Electoral Commission, INEC, plans to conduct a credible, free, fair and safe election. So far, compliance with the safety protocols is a challenge. However, some residents are seeking improved adherence to the guidelines ahead of the elections. Mr. Nwachukwu Orji is the INEC rec in a number of states, and he joins us now from Awka. Thank you for joining us on the program. My first question to you is, how ready is INEC to conduct elections under the second wave of COVID-19?
I would say that INEC is prepared. We have done it before. We conducted governorship elections in Edo and Ondo in the last quarter of last year. And in December, we conducted elections in various federal constituencies and senatorial zones in Nigeria. And then we think that we have put measures in place to ensure that elections go smoothly, even in this context of COVID. INEC has released a policy on conducting elections in the context of COVID-19 pandemic. That policy captures the rubrics of things that are needed to be in place, including health issues, legal issues, election planning matters, electoral operational issues, covering ICT and voter education. So we have really made arrangements. We have done it before. We are ready to do it again.
As we've heard previously, and interesting you mentioned Ondo and Edo, because if you notice those elections, things like physical distancing were missing. But looking at, this second wave and how virulent we're hearing it is, experts have listed some areas of concern, like expanding voter access to polling units. And don't forget the context of a growing population. There's also the validation, of the voters' card and the continuous voter registration. So what are you doing about some of these concerns?
INEC is responding to these concerns. There are already plans in place to ensure that the voting locations are expanded to take care of growing population. We have set a benchmark in the past of 700 voters to one polling unit. We'll continue to ensure that we make voting locations available to people that are ready to participate in the process. Continuous voter registration will soon come on stream so that we can register those that are not yet on the register. And then we can be able to reallocate voters to new voting locations.
The amendment of the Electoral Act has been on the front burner for some time now. What's the latest in the passage? And this is ahead of the Anambra governorship election.
you know that the issue of amendment of the Electoral Act is squarely in the confines of the National Assembly. But I feel as we are receiving from the National Assembly is that the process is ongoing and progress is being made. We are hoping that the National Assembly will take care of some of the issues that have been raised. We had fruitful discussions with them in the past. The Commission is still engaging them, but it's squarely the responsibility of the National Assembly to make laws.
So let's look at voter apathy. I mean, it was a major concern even before the coronavirus pandemic. What's the messaging now to, enlighten people and also increase voter turnout when the elections come?
The experience we have had in Ondo and Edo states show that people are quite interested in participating in these processes. Anambra has a history of voter apathy, which we have been working on. In fact, the last election that was conducted in the state was the 2019 general election, and it saw the highest increase in the number of people that participated in elections in that state. We'll build on the progress we have made during the 2019. We have messages that we will let out to people, messages that we'll be targeting to educate people on their rights as voters, on their rights as citizens, on the benefits of participating in the process. And we have also taken care of the concerns people might have regarding COVID. We have developed a code of conduct for the voters to ensure their safety, and we educate voters using this code of conduct and making sure that they participate in the process in a safe environment.
And this code of conduct will be made known to people how soon?
It's already a public document. It's titled Voting in Safety, Voters' Code of Conduct for Elections During COVID. It's one of those documents that INEC rolled out in preparation for conducting elections in the context of COVID. This document came alongside the policy that I mentioned earlier that the Commission released. So, and this captured the rubrics of all the issues surrounding election in the context of COVID. And this would be a major basis for voter education for us as we approach a number of elections.
All right, we appreciate your time. Thank you so much, Mr. Nwachukwu Orji, INEC Rec, Anambra State. Thank you for joining us on the program. All right, now South Africa has joined the list of a handful of African countries to receive its first batch of COVID-19 vaccines. Initially scheduled for the end of January, the first 1 million shots of the AstraZeneca Oxford vaccine produced in India will be used to inoculate healthcare workers over the next 3 months. The second batch of 500,000 jabs is scheduled to arrive later in February. Now, despite criticism from opposition parties and medical experts that the procurement process of the vaccine has taken too long, Minister of Health Zweli Makhezi has called the arrival of the vaccines from the Serum Institute of India a massive achievement of unprecedented proportions. South African president there in receipt of the vaccines. Well, continue to take responsibility. If you have symptoms associated with COVID-19, then please visit one of the sample collection sites in your state to get tested. Visit our website, channelstv.com, for more updates, also a better understanding of the pandemic. You'll also find several other stories there as well. That's the COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay healthy.